everyone. Our first topic is about venous thromboembolism. There will be a short video about its definition, its pathogenesis, and its clinical manifestation.
The body creates blood clots to help stop bleeding and help wounds heal. For example, scabs are blood clots on the skin that form to stop bleeding from a cut or injury. Clots also form when you have injuries inside the body. Most of the time, the body will get rid of the blood clot once it starts healing. However, blood clots can cause problems. Blood clots forms in blood vessels within the body. Blood clots in veins close to the skin are usually not serious. However, when blood clots form in deep veins of the legs, hips, pelvis, or rarely in the arms, neck, or chest, this can be dangerous and require medical attention. Another word for veins is venous. A medical term for blood clot is a thrombus. When this thrombus or blood clot breaks off and travels from one vein to another part of the body, it is called an embolus. Hence the term VTE, which is venous thromboembolism. A clot which forms deep vein in the body is called a DVT or deep vein thrombosis. A clot that breaks off from a deep vein in the body and travels to the lungs is called a PE or pulmonary embolism. Most DVTs are clots that form in veins in the legs, hips, or pelvis area. They can also form in the arms, neck, or chest area. These deep clots clog up the veins and slow down the blood flow, which leads to symptoms. Warning signs of DVT or clog in the deep vein include pain in one leg or arm, swelling because the outflow of the venous blood is prohibited, skin that is red or not its usual color, and warmth in the area that has the swelling. When a blood clot breaks off and moves to the lungs, it is called a pulmonary embolism or PE. Warning signs of a PE or blood clot in the lungs include dyspnea, pain in the chest, fast heartbeat, dizziness, and coughing up blood. A big clot in the lung, or PE, can keep blood from getting in the lungs, cause heart trouble, and may be deadly. With proper management of this condition, the patient can recover from PE. Damage to the lungs by a clot or PE can cause scarring of the lung blood vessels or its other parts.
What factors play a major role in the development of VTE? Well, to answer that question, we must review Virchow's triad. Virchow's triad gives us three main factors that can lead to blood clot formation within a vein. Remember, there are three factors. Anyone can develop a venous thromboembolism, especially if the risk factors are present. Remember the acronym SHE, SHE.
The first part of the Virchow's triad is stasis of venous circulation. Blood cannot just hang out and become static within a vessel. If it does, the blood will start to clamp up and form a clot. The venous system is responsible for taking the oxygenated blood back to the heart. Therefore, the blood has to flow back to the heart via the veins, and it does this with the assistance of healthy vein valves and the muscles within the extremity. If the vein valves are damaged or the muscles aren't working, blood isn't going to flow back very well and a blood clot can develop. Here are some conditions that cause stasis of blood flow.
The next part is hypercoagulability. Let the name of this factor help you. Hyper means increase or high, and coagule refers to the coagulation process in the body, hence forming a clot. Therefore, the patient has a high risk of forming a blood clot. The main reason for this is due to a disease process, or it can be due to other reasons. Well, these are like cancer, pregnancy, etc., as presented in the slideshow. The last part of the triad is the endothelial damage to the vein. This endothelial is a layer of cells that lines the inside of the vein. Damage to this layer can be from a direct or indirect cause. But regardless, it stimulates platelets and the coagulation process. So think of anything that damages the lining inside the vessel. It could be from trauma, surgery, local vein damage, repetitive motion injury, IV drug usage, and indwelling devices. Here are some possible complications of venous thromboembolism, or VTE. First is post-thrombotic syndrome, or PTS, in which poor blood flow, inflammation, and blood vessel damage from deep vein thrombosis cause swelling and discomfort. PTS is a long-lasting condition that can be disabling. Another is pulmonary hypertension, which occurs when pulmonary embolism blocks blood flow and raises blood pressure in the vessels leading to your lungs. This condition can lead to heart failure. For the diagnostic test for venous thromboembolism. Now, to diagnose a VTE, we use a Doppler ultrasound, which is non-invasive. If that does not work, we cut that patient open and inject contrast dye into the veins. This contrast highlights the vein to see where the clot is located. This is called a venography. The dye that is injected in the vessel has iodine, also termed as contrast. So per nursing intervention, it is important to assess if the patient is allergic to shellfish or iodine itself. Next is computed tomography angiography, or CT angiography, which is used to take pictures of your blood vessels and look for blood clots in the lungs and legs. This is the most common diagnostic test for pulmonary embolism. Next is pulmonary angiography, which is used to confirm pulmonary embolism. This test requires inserting a tube in your blood vessel. It also uses X-rays to create video of the blood flow to your lungs so the physician can identify any blood clots. Lastly, D-dimer test, which is used to measure a substance in the blood that is released when the fibrin proteins in the blood clot dissolve. If the test shows high levels of the substance, you may have VTE. It measures that there is actual clot breakdown in the body and shows elevated clot breakdown. Goal treatment for VTE revolves around preventing the dislodgement of the clot. If the clot loosens or floats away, it can get vacuumed right into the heart and then into the lungs, causing pulmonary embolism, which can worsen the situation. So use the acronym DVT to remember the priority nursing interventions. D for don't walk or move too fast. This means bed rest. The clot is like a ticking time bomb waiting to get loose. So, no hot pad, only warm and moist pads. Because heat is a vasodilator, so opening the blood vessel will loosen the clots. And speaking of bed rest, no SCD, or what we call a sequential compression device, and TED hose, which are stockings that help prevent blood clots and swelling in your legs since it may dislodge the clot. Remember, the patient is in bed rest. Now for V, which is for venous return, which means we elevate the extremity. All venous problems, remember, V for elevate. Now after the clot is dissolved, We use T for teaching, which is teaching clot prevention. So remember the acronym CHANT, CHANT. C is for calf exercises to move that blood around and preventing the stasis. H is for hydration. Remember, drinking 8 glasses of water per day. Fluid helps make the blood less thick, making it easier for blood to move around the body. A is for ambulation, so moving that blood around. Walking is always the best way. N is for no long sitting, which does happens in cars, airplanes, and bed rest. T is for TED and SCDs. This is only after clots are resolved. This helps move blood back up to the heart, stopping the pool of blood, also known as stopping the stasis of blood, where it stays just in the legs. For pharmacologic therapy, medications for preventing or reducing blood clot within the vascular system are indicated in patients with thrombophlebitis, recurrent embolus formation, and persistent leg edema from heart failure. First is unfractioned heparin. It is given subcutaneously to prevent development of DVT or by intermittent or continuous IV infusion. Next is low molecular weight heparin, which prevents the extension of a thrombus and development of new thrombi. They are associated with fewer bleeding complications than unfractioned heparin. Medications under LMWH are dalteparin and enoxaparin. Next is oral anticoagulants, which is indicated for extended anticoagulant therapy. Factor 10A and direct thrombin inhibitors. Fundaparinux selectively inhibits factor 10A. Rivaroxaban, apixaban, and edoxaban are indicated for fixed-dose regimen for treating acute deep vein thrombosis and for VTE prophylaxis. Direct thrombin inhibitors are indicated for treatment for heparin-induced thrombocytopenia. An oral direct thrombin inhibitor is indicated for treating acute deep vein thrombosis and for VTE prophylaxis. Lastly are the thrombolytics. It lyses and dissolves thrombi in at least 50% of patients. The advantages of this therapy includes less long-term damage to the venous valves and a reduced incidence of post-thrombotic syndrome and chronic venous insufficiency.
Here are some other treatments for venous thromboembolism. First is catheter-assisted thrombus removal. In some cases, including emergencies, a doctor may need to do a catheter-assisted thrombus removal. This procedure uses a flexible tube to reach a blood clot in your lung. The doctor can insert a tool in the tube to break up the clot or to deliver medicine through the tube. The second treatment is vena cava filter. Some people who cannot take blood thinners may need a vena cava filter to treat their deep vein thrombosis. The filter is inserted inside a large vein, which is the vena cava. The filter catches blood clots before they travel to the lungs, which prevents pulmonary embolism. However, the filter does not stop new blood clots from forming. Here are the nursing diagnoses for venous thromboembolism with its corresponding nursing interventions. Ineffective tissue perfusion related to impaired peripheral circulation. Its nursing interventions include administer prescribed anticoagulants or platelet aggregation inhibitors to prevent new clots. Administer thrombolytic as ordered by the physician, which is to dissolve existing clots and reestablish blood flow to the affected area. Apply warm, moist packs to the affected area as ordered, which is used to improve circulation. Assist patient in the placement of anti-embolism hose, which is to prevent stasis and improve circulation. Lastly, is to explain how stress reduction and smoking cessation also improve tissue perfusion because it reduces vasoconstriction. Acute pain related to impaired circulation and tissue ischemia. Its nursing interventions include administer analgesics as prescribed, implement other prescribed comfort measures such as warm, moist soaks, and elevation of the extremity. Then, massage is contraindicated because it may dislodge a thrombus. Impaired skin integrity related to venous stasis. Inspect the skin to detect early signs of breakdown. Compare the extremities of symmetry in color, warmth, pulses, and circumference. Elevate affected extremities to promote venous return and improve circulation to the area. Then, encourage good nutrition and adequate fluid intake. The prognosis of venous thromboembolism. After an episode of unprovoked VTE, the risk of further episodes after completing treatment remains elevated, although the risk diminishes over time. For each episode, the risk of death is 4%. Many DVTs will resolve with no complications. Post-thrombotic syndrome occurs in 43% 2 years post-DVT.